Hi, I'm David, and I have stage 4 cancer. And Debbie, my wife, and I, we've been producing these videos, and you know, it's been a year since my last chemotherapy treatment, and we're going to try to keep doing those videos as long as we can, and we hope they're useful. And today we're going to talk about palliative care because it's been so important to me in my journey. Debbie, what is palliative care? Why don't you explain?
One of my favorite topics.
Yeah.
Palliative care is a program of care that is focused on individuals and improving the quality of life for a patient and the family who have a life-limiting illness. And it does that through prevention and a real focus on physical symptoms, pain, and psychological and spiritual issues.
Well, what difference is that in hospice care?
Yeah, people get them confused. Palliative care is for individuals with a life-limiting illness, as I said, where hospice is for those with a terminal illness and a prognosis of 6 months or less. So really more end of life than palliative care, and they're not mutually exclusive. You can have palliative care all the way through hospice care, and they'll work at referring you into hospice when it's the appropriate time.
So I'm getting palliative care, and eventually I'll get hospice care.
That's right,
Yeah.
but not yet.
Yeah, that's hopefully for a while.
So David, what has palliative care meant for you?
Oh, well, gee, I don't know where to begin. You know, let me give you a couple examples. We went to see Clay Anderson. Dr. Anderson is a medical oncologist in Kansas City and a very close friend, and he also is expert in palliative medicine. And he helped explain what was going to happen. And I think that's the most important thing, to be able to anticipate what's going to happen, and then to have a palliative care team there to help you with the things that do happen. He was able to explain to me, for example, what happens in those 21 days between my chemotherapy treatments. Some people have different days and times, but it was very helpful for me to know. You can go to video number 4. Video 4 is where I explain exactly about those 21 days. And so they're very predictable, and that's important. He also helped me tremendously in telling me that after that first chemotherapy treatment, I'd be about 90% of myself. And the way to see how it goes progressively, he says, just multiply 0.9 each time. So 0.9 times 0.9, after my second treatment, I was 81% of myself. And then you take that 0.81 times 0.9, 72% of myself. And then 0.72 times 0.9, and so on. And after I had 6 chemotherapy treatments, so in the end, I was about 53% of myself, and I was.
Yeah, for sure.
I was a mess. And it took about 6 to 8 weeks just to recover from that treatment. So he was extremely helpful to me, and the palliative care team too. What about you?
You know, and it was important to do that before you had treatment. So what are they doing for you now? Oh
my, we're meeting about monthly, and they continue to help me with physical pain issues. I have neuropathy, for example, as a leftover from the side effects of the chemo, and we've talked about psychological and social issues, and some spiritual discussions recently, which I didn't think I'd ever get into, which have been extremely helpful. Now, Debbie, palliative care also helps the caregiver.
Yeah, and they help both of us actually in making decisions to understand the risk versus the benefits, and we've been having some ongoing discussions about that. But more importantly for me, our palliative care nurse basically is going to take the role of backup quarterback. We've talked about me being quarterback and the responsibilities that has, and it's really nice. All quarterbacks need a backup in case it gets to be hard, or you get confused, or you need somebody to help you remember those preferences and help sort through all of the information and make those decisions. Also to cry on their shoulder and to give you some extra hugs. That's not a bad thing either. And finally, our palliative care nurse is going to be with us throughout the whole process, so that she's going to help me enact your preferences and help that exit strategy.
Well, I do have an exit strategy. I've used the acronym HOPE, and video number 12, I outline exactly how I want to die, and I want everyone to be aware of that, so that when a time comes, you know, everyone will know what to do.
David's done a good job about documenting that, not only on our video, but also in a new ebook that's just out. We've got the link to that on the video blog if you want to take a look at that, and also a special website that's got some family photos and so on. And I'll put that at the end of the blog. And please like our Facebook page, and you'll get to know when we have new information if you're a Facebook user.
Palliative care and cancer treatment are really two sides of the same coin. They go together. They go hand in hand, and should. And progressively, I think they will in the United States. And so always look to palliative care. It's going to be helpful. And also look to the NCAA tournament that's coming up, because our Tigers are going to be in that.
Go Tigers!
Go Tigers!